1, and now we're live. Here we go. TikTok live number 56. We're up to 56 now, guys. That's pretty sweet. Top 5 listeners who stay on the longest part of the whole time of the live. I'm going to be giving you guys a shout out in the caption, all right? All right, let's get after it. So cbenjiiiii first said, how's it going? It's going good. I had a good weekend. I was out on Long Island. Went to Spider Bite Brewery, got some beers. It was like a comedy show last night. And then I did some gardening. And this weekend I was trying out a new band. This is my Blue Citizen. This is my first birthday watch. 9 years ago now, almost 10 years ago now. Would you imagine that? But it's a Citizen Grand Touring Sport. It's blue. And it's like a diver, but it's like a classy diver. I guess they tried to make it, and the band had a loose screw. So I was like, and it like once a year, one of the screws, it's got like 10 screws in it. One of the screws or pins, you might call it, to keep the metal link in place, would come loose. And I just got sick of it. I got sick and tired of it. And I figured this would kind of diversify my watch options. I got mostly metal or rubber watches. This is one of the only leather ones I have. So I don't know, gives it some versatility. All right, let's keep it going. Let's keep it going. User 3274 said DAT in 2 days. Oh man. Well, good luck. Get that in. DAT, huh? M8, how do dental school exams compare to the USMLE Step 1? Not even close. Not even close. You're saying you take STEP in 2 months. Are you taking you mean the CBSE or the actual STEP exam? Yeah, no, it's completely different. I think the USMLE questions are much harder than dental school exams, honestly. Jay, Doc, do you remember how many OMFS programs you interviewed and ranked? Yeah, I was in the COVID year and everyone applied to a significantly more number of schools. So I was looking to apply to between 20 and 30 programs. I ended up applying between 30 and 40 programs. Remember, I was the COVID year. Everyone, they got like record numbers of applications that year. So yeah. And then I interviewed at 15, something like that. That's how it went. Debbie said, getting a tooth pulled tomorrow, Debbie. Good luck. You're going to be just fine. Don't worry about it. Hopefully you're going to, one of the dentists that pulls teeth often. That helps. How many days do I have to worry for dry socket? Generally, dry sockets happen between days 3 to 5. So after about day 7, you're kind of out of the window for the dry socket. Now, how do you prevent a dry socket? Number 1, 2, and 3 things. No smoking, no drinking through straws, no strenuous exercise, no spitting. That's another one of the 3, okay? So let's summarize those. No spitting, no smoking, no drinking through straws, and no like bending down to pick anything up, no heavy lifting. Don't run a marathon the day after you get your tooth pulled. Once that blood clot gets dislodged, that's when you get that exposed bone called alveolar osteitis. That's a dry socket. It's one of the most painful things in this world. So hopefully you don't get that. That doesn't happen to you. Casual Calvin said, you got any recommendations for field watches? Looking for one under 300. So I'm a big fan of 3 brands that you could get for, I don't think Jack Mason you could get for under 300 anymore. Worth looking into though. Jack Mason is excellent. It's a brand out of Texas. Otherwise, watches that you could get for under 300. I love Citizen. This is not under 300. This is like a different, but Citizen, they got great, and Seiko. They're both Japanese brands. They got excellent selection of watches under $1,000, I would say. But the reason why I like Citizen so much is like this one. It's an automatic watch. I've never had it's over 10 years old. I've never had to bring this in for a repair. All my Citizens, they hold the best time to the T. It might lose like a second a month. All of my Citizens, I have like 5. All of them are excellent like that. And they're solar powered too. Not this one. This is automatic. It's powered by movement. All my other 3 Citizens, 3 or 4 Citizens, and they're all 4 other Citizens. They're all powered by solar, and they're excellent. You never have to charge them. They never need any to get serviced at all. Excellent. So I would definitely recommend looking at Citizen, and you can order them on Amazon. It's real easy. Another good brand under 1,000 would be Hamilton. Loney MCK said, watch your YouTube video with Paul Vigario and felt really encouraged, inspired as an incoming D1. Awesome. Yeah. Paul's got a lot of big things to say. He's very hopeful for things that are coming to the future of dentistry. From his standpoint, he's not a dentist. He's an owner of Surf CT. It's an IT company, but they do other things too. They do like office renovations. They do, they'll change out all your office and get you new computers, new IT systems, and they do a really good job at it. They're expensive and they're worth it. They do really good. So Paul, if you ever listen to this, giving you a good word. Paul also helped get High Point University, the dental school. What is that? I forget the first of High Point dental schools. Hunt. Hunt Dental School. I don't know, whatever. He's involved with that. David Pena, are you going to miss trauma cases when you go into private practice? Yeah. I mean, I might if I have to cover at a hospital. If I have to take call at a hospital and it's a level 2 or 1 trauma hospital, I'm going to be getting a lot of trauma. And I'm going to be doing it there. For me though, I got to be honest. I don't really enjoy working in a hospital setting. Like 0%. I enjoy 0% of my time in the hospital. I really do. Whether I'm a patient or I'm working, I don't really enjoy it. And maybe it's the hospitals I've worked at, maybe it's the residency experience, but I love the clinical area. I love the dental clinic. That's my home. I like to go in there. I like to do all big implant cases, sedations, extractions, all that stuff. But I have it much more. I don't know. I really enjoy doing dental alveolar stuff, just here. But the funny thing is, I do like doing orthognathics. I do like doing trauma and fractures and putting the face back together. But God, it's just, I can't stand working in the hospital. I don't know what I'm going to do about that. Am I going to miss it? Yeah, I'm going to miss doing cases, but I'm not going to miss any minute spent out of the hospital. I love these minutes. Gosh, yeah, great question. Isaac, any dental school aim, top grades, tips. DN, don't want my whole life about dentistry though. So you're asking for recommendations for getting the top grades? I mean, you just got to study. Any dental school aim, top grades, tips? The Quizlet? I would say Quizlet. Workman, yeah, Lonnie MCK and webbcgarrett. Workman, that's right. Not Hunt, not the other. It's Workman, yeah. webbcgarrett said, I go to HPU undergrad. Oh, no way. You're in North Carolina. You're at a High Point University undergrad. I heard that's a pretty beautiful university in North Carolina. Is that right? Is that the one I'm thinking of? There's another one down there. Coastal Carolina. That's another gorgeous one, right? I've never seen any of these. I've just seen pictures and I'm like, I wish I went there. Zane just got the number 2 gifted bed. Denton Schaffer followed the live creator. Thanks, Denton. Garrett said, yes. Yeah, I knew it. High Point. I remember there was a girl on track that went there to run. That's Division 1 too, right? That's awesome. Yeah, that's an excellent. Another thing that came up today, this was a Gary Vee quote. I was listening to the podcast and Gary Vee was saying, I mean, this is a common quote from any culture. He was saying that man makes plan and God laughs. That's so classic. I think that's a really, really important thing to keep in mind. See, Benji, tips for finding a dental school with a good culture. Definitely go to a dental school with a good culture. Although how to find a dental school with good culture is by far one of the most difficult things, because you're there for like an afternoon or a morning interviewing and maybe touring the campus, but you don't really get sufficient time or opportunity to really speak with students there. You get the time to speak with, but you don't get to see the culture. That takes like days to really understand. The best thing I think for culture is really just oral surgery externships. When you go spend time at these programs, you get an idea of how happy the residents are. Dental students, when you meet them for an afternoon, it's difficult. It's very difficult to do that. webbcgarrett said HPU, High Point University, has awesome facilities. Very underrated science program too. Yeah, I love it. Oh, that's great. A lot of, or maybe it's just the Northeast, but yeah, college is a good time. Oh, said, are you a Yankees fan? I don't really watch. I wish I had time, and I wish I watched more sports. I like to watch football, NFL football, which is cool, even though I never played it. I played basketball in college. I don't really watch baseball, but if I was a fan, I'd be a Mets fan. Neo said, interested in OS, class rank is about middle of the class. Is it possible to do OMFS with a good CBSE? Yeah, that is possible. And intern year? Yeah, intern year is a monster. YHLQMDLG, when was the moment you realized you wanted to go into dentistry? I think it was the summer in between my 3rd and 4th years of college, of undergrad. And I was shadowing some dentists that I had met at the gym. And I would see them early in the mornings and the weekend when I would get there. They would always go right when it opened. So I would miss them during the week because they would go there at 5 a.m. And then I would see them on the weekends because it opened at 7 and I could get there at that time. But super motivating, big fitness guys. And they were just so inspiring to me at the time. And so seeing what they did for a living and knowing their vibe, the atmosphere of being around them. I mean, they're the type of people where just everyone else got better. And that's who I wanted to be. So that's really when it kind of clicked. It was that summer when I got to shadow in offices and see what the dental clinic life was like. Maybe that's why I don't like the hospital setting and I prefer the dental clinic too. You never know, right? But all right, let's keep it going. Ariel said, Ariel in finance and tech is doing there we go. Is doing a surgery scary when you're new, like wisdom teeth, for example? Yeah, I mean, I guess you could say, yeah, I guess it could be scary at times. Sometimes it's not. It's always scary when you realize how much you don't know about like taking out teeth, for example, something that you find out pretty quickly in oral surgery residency because you're doing it so much, like all day, every day, half asleep with one eye open. Yeah, no, literally. And yeah, you kind of just, realize how much you don't know about taking out teeth, and you learn as you go. I used to put myself through I wouldn't go to the drill to get out teeth my first year residency. I would solely stick to using all the instrumentation. And I found that root tip picks are great for root tips, obviously that, and then the periosteal sometimes. Middle root fractures, I love using the spade, or even full root fractures, or just root tips. I love using the spade. I feel like I could get any tooth out with that thing. That thing is excellent. Yeah, especially a back action spade. That's my favorite instrument, I think, of all. All right, let's keep going. Ariel said, Ariel just got the number 3 gifter badge. Awesome. Teddy the Yorkie. What's up, Teddy the Yorkie? Do you remember your first trauma case? No, I don't. I do remember having to do big lacerations like in the middle of the night very early on. I do remember that. Mohana said, what are your thoughts on High Point Dental School? Well, I mean, I think it's being opened by a DSO, and it sounds like they're bringing a lot of fresh ideas to the dental school space, which is great. I just don't like the idea that a DSO is opening a dental school. That's like textbook conflict of interest to me. So that sounds a little sticky. I'm a little sketchy about do you know what is DSO? Think about that. That's like textbook conflict of interest. Amar Hassan said, UK dental student here. Would you say it's worth the money to get the DDS qualification to come to the US? I don't know. I don't know your situation there, so I wouldn't be able to. I don't have a comparison. It would be like apples to nothing. So I wouldn't be able to give you a fair comparison. You know what I mean? But if you're in dental school there, you would have to repeat at least 2 to 2.5 years of dental school in the United States in an advanced standing program to get your dental school degree, on top of paying for it. And in some states, you still need to do a residency anyway. There's a lot of things to consider. You're working against time in that respect, in addition to against money. Right. Fabi Coded said, pre-dental student here. What dental school did you go to? I went to Stony Brook Dental School. It's out on Long Island. It's in New York. And David Pena said, is there surgery type cases in perio? Shorter residency looks more appealing. There are surgery type cases in periodontics. And in perio, the thing I like? Yeah, it's 3 years. I mean, I'm in a 4-year residency. Pretty comparable. So 1 less year. All right, fine. But they don't take call. I really like that they don't take call. If I was to do residency again, I would highly consider a perio residency at a VA, because the VA, I think they still get a salary and they don't have to take call, and all implants are 100% paid for at the VA generally. So that's kind of like a home run type of experience. For me, when I was there, that was my favorite rotation in oral surgery residencies at the VA, because everything's paid for. So it's like, you're missing a tooth back there. You got plenty of bone. You want one? Yeah, all right. It's like you're a kid at a candy store. For implants, literally like thousands of dollars, and it's like, hey, let me get another one on the left. Crazy stuff. But I got the greatest implant experience because of that. So yeah, food for thought. But yeah, a perio residency does sound good. The problem is that when you mess up in perio residency, you send things to oral surgery. So oral surgery are the big dogs, and perio, I'm seeing a lot of, I don't know. I'm seeing a lot of things that I don't know. I don't like the butting heads. We need to all come together and command the insurance companies to start making things a little bit more accessible for patients, which is what insurance was designed to do, right? But they're not doing it. So that's what I think we all need to be doing. And I don't like the banter. I don't like the butting of heads on like implant cases. What they can do. No. Like, let's fix this insurance issue that we're having, and more people be able to get healthcare. Better, more appropriate reimbursement will happen to all providers, so people aren't fighting over the implants. Okay, that's the fact of the matter. And I wish we could talk about that a little more. Sports Talk TV said, advice for pre-dents that have to retake a class they failed. Does admin look at this as a positive? Well, they're probably not looking at that as a positive, right? If there was a failed class that has to be retaken. Before failing a class, I think I would try and drop that course, so that it just looks like a drop on your permanent on your record, rather than an F, and then maybe retaking it in the summer or something. That's what I ended up doing. There were 2 tests. I took physics at NYU Polytechnic Institute, and there were 2 tests. There was the midterm, and it was 10 questions, and there was the final, and it was 10 questions. Literally, you could get like 3 wrong on both exams, and you get a C for the course because you average a 70, right? Like that was the whole course, 3.5 months worth of schooling, and it comes out to 2 tests. I mean, that was wild. So I took the midterm, I got like a 60 or 70, and I'm like, I think it was like a 60, right? Super hard. The hardest, it was some Russian guy. This guy was like, he was talking about, I don't know. He was really good at physics, and we're like undergrad students, and 2 tests, yeah, I got a 60, and I'm like, so even if I get 100 on this or 90, I'm only going to get a C or a B. So I dropped it, took the course in the summer, got the B plus A or whatever, probably B plus. I wasn't great at physics. I was more of a chemistry guy, organic chemistry guy. Yeah, so it's not going to look great, but do what you have to do. You know what I mean? Ryan Mood said, I'm thinking either IM or surgery. How do you think I should go about deciding? I think you should do as much clerkships, right? Because you're in medical school. You should be doing as many clerkships as you can with those two areas. And in surgery, the variety of surgery, right? I would also really think about what you're going to be like. What are you going to end up doing with an IM residency? What are you going to end up doing in what type of surgery? So think about what you'd be most excited to be doing for the rest of your 30, give or take, year career. Because I think you're going to want to be happy doing it. You know what I mean? You don't want to be annoyed or pissed off every day or depressed. So try and look at the end product, because even if you're in plastic surgery or surgery residency, ortho or whatever, it's 5 years long. You want to make sure the rest of your 25, 30, 35, or give or take years career, that those are the years that count, that you're excited and happy, okay? Where's that? Wow, Landon Mackerdle. Did you ever make a C in dental school? I didn't get any C's in dental school, thankfully. I didn't get any C's in undergrad as well. Actually, that was my biggest thing throughout undergrad and dental school. My rule for me personally, I was like, I can't ever get a C. I need to maintain A's and B's. And I didn't get like all A's, you know what I mean? But I maintained all A's and B's. That was like my thing. And I was like, if I could do that, I think things will work out. And they did. You're super stressed at times, and you know what I mean? And you're like, oh man, if I'm like 50% A's, 50% B's, for example, am I going to make it? Am I going to get into dental school? Am I going to get into oral surgery residency? And it worked. Listen to this, okay? Regardless of what your grades are, work as hard as you can. Be a good person. Be a team player. Get as much exposure and observation of that future career that you're looking for, and go for it, okay? And don't ever look back. Do it, okay? And that's for you. Sam Miller 3, what's up, man? What's up? Mahana said, they don't require the DAT, and I don't know how their board's passing rate will be. That's true. I mean, I don't think it's too hard to pass. Well, I mean, it changes every year, so I don't know. MXH2203, how often do you do unconscious pelvic exams in oral surgery? I haven't done any pelvic exams. They just banned them in New York City in 2019, thanks to Trump. I don't know what an unconscious pelvic exam is, but that sounds really inappropriate to be doing as a dentist. King Tam said, hi, incoming med student with a question on which school to pick. Sure. What's up, King Tams? Let me know. webbcgarrett, Garrett, if you were pretty set on specializing, most likely OMFS, and could go anywhere for dental school, where would it be? Ooh, wow. Great question, Garrett. Wow. That's such a great question. You know, I'd probably go to a pass-fail school. I would just go to the dental school that has the best culture. You know what I mean? If you're in a school or a residency program where you have the best culture, you might not be getting 100% best experience in the world, but you're going to be motivated to go in and make the most of that day. If you're at a place where it's a really bad culture, you're really down, you might be depressed, even you might not be going through good things at that time, that's going to take away from that motivation. It's going to take away from that excitement of going into work every day. And that literally just goes for anything, not just like surgery or residency or dental school. That's just anything in life. It's a job, right? So Landon McCardle, do you ever get a C? Nope. Kareem Al-Sharbini said, how a non-U.S. citizen can apply for OMFS residency in the United States? Well, you have to go back to dental school in the United States, get your degree here, and then apply to residency from there. FL said, thoughts on urology as a medical specialty? I don't know. I'm not the big urology fan, I guess. I don't know. I've placed a lot of Foleys. I've had to place a lot of Foleys. I'm kind of a specialist now at placing Foleys. Jesus, I remember the first day in residency, and there was an orthognat. It was like the first week, whatever it was. I had no idea that we had to place Foleys in residency. And so my first week, fresh out of dental school, right? And the chief, we're set up for an orthognathic, and then the patient goes, they put the patient to sleep, the anesthesia team, and then the chief turns to me and says, all right, Gallagher, put in the Foley, let's go. And I'm like, what? I thought nurses do this. I thought nurses put the Foley. You know what a Foley is? That's the bladder tube that goes up your urethra. And I'm like, I got to place the Foley now? He taught me how to place the Foley, and then since then, I've been placing Foleys. And all oral surgery residents, I think that's how it is throughout the country, right? It's not just our program where we have to put Foleys in everywhere. Or is it? Anyway, yeah, so that's how it goes. Ryan Moon, you answered my question earlier. I'm thinking CT surgery through the surgery route or EP and IM. I mean, you got it. So it's going to come down to surgery. Do you want to do surgery or something else? And CT surgery, by the way, that takes forever. It's like, what, 8 years? Jesus Christ. By the time you get out, your whole life is a residency. I don't know. Think about that, man. Think about that. Also, you got to think about the end product, because that time's worth it. If your dream goal, like you live, eat, sleep, and wake up to do surgery, well, then you got to go that route, right? You need more exposure to get that determination, to come to that conclusion. Excuse me. King Tam said, hi, bumping again. Wanted some advice on which med school to choose. Yeah, King Tam's what? Oh, between Yale and Duke, with my interests lying in ortho. Well, let's do this right now. Let's do this right now. Okay, I'm going to ChatGPT. Check this out. Let's get to the bottom of this right now. ChatGPT. Which school? Where is it? Which medical school has a higher match rate into orthopedics in the U.S.? Yale or Duke? I do this stuff all the time. Let's see King Tams. Let's see what it says. I'm using ChatGPT too. I like Grok and ChatGPT. Those are my two AI search engines. Yale School of Medicine in 2025. Yale achieved 100% overall match rate in participants going into surgery, securing residency positions, not surgery. I'm sorry, not surgery. Specific data on how many matched to orthopedic surgery was not disclosed. In 2005, Duke had 120 students participate in match. Of these, 11 students 9.2% matched into orthopedic surgery residency programs. Well, let's see. How many students matched into ortho surgery residency from, who is that? Yale this year or last year? Let's see, right? Because let's compare this number. So far we have a 9.2% from Duke. That was 11 students. So of 120, 11. So about 10%. And okay, it's not. Oh, wait. It looks like Yale 2025 match. Yale placed 3 students into orthopedic surgery residencies. So there's your answer, King Tams. Yale placed 3 into ortho residencies, or orthopedic surgery residencies, and Duke placed 11 out of 120, so 9%. So 11 versus 3, it sounds like you have more of an opportunity to get into orthopedic surgery residency going from Duke. Just that's what it looks like from here. I don't know. I'm in the dentistry track, so don't take this advice from me, but that's what ChatGPT is saying. Podcast Negocio said, "Hi Doc, by any chance is there an opportunity for international DS to apply to maxillofacial residency?" No, you'd have to repeat dental school and get your degree there before applying. David Pena, and last couple questions, guys. David Pena said, "Do MDs treat you differently in the hospital?" Sometimes they do. Most of the time they don't, but sometimes they do. Sometimes they do some, I don't know, kind of get ignored or shunned. And sometimes, when you're the dentist, but generally everyone's really nice and everything. So generally everyone's very inclusive and nice and friendly. Like 99%. I'm talking about that one of like 100 residents that I've come across, and you know what I mean? Niaha said, "What do you think about NYU BA/DDS?" I think that's a good idea, because then you get it down for, instead of 8 years altogether, down to like 6, right? So, all right, friends, I'm signing off. This is TikTok Live number 56. Thanks so much for coming on. Happy Sunday night. The top 5 listeners that stayed on the longest on this TikTok Live, I'm giving you guys a shout out in the caption of YouTube and the podcast when I put it up. All right, friends, thanks for coming on. You guys all have a good night, and I'll see you probably next Sunday. I'll see you guys next Sunday.